Today, we're diving into a pharmacology test on diuretics, key drugs for managing conditions like hypertension and edema. This test includes 10 multiple-choice, scenario-based questions, each with 5 options and detailed explanations for the correct answer. It's designed to give you more practice and enhance your understanding of this essential topic. So, let's begin. Question 1. Mrs. White, a 70-year-old female with congestive heart failure and a recent myocardial infarction, is on a combination of diuretics. Which of the following combinations of diuretics is most appropriate to avoid potassium imbalance? Option A, furosemide and hydrochlorothiazide. Option B, hydrochlorothiazide and spironolactone. Option C, spironolactone and amiloride. Option D, furosemide and torsemide. Option E, chlorthalidone and metolazone. The correct answer is option B, hydrochlorothiazide and spironolactone. The explanation is that hydrochlorothiazide, a thiazide diuretic, can cause potassium loss, while spironolactone, a potassium-sparing diuretic, helps retain potassium. This combination balances potassium levels, reducing the risk of both hypokalemia and hyperkalemia. Other combinations, such as furosemide with hydrochlorothiazide or chlorthalidone with metolazone, may lead to excessive potassium loss, while spironolactone with amiloride could cause dangerous hyperkalemia. Question 2. Mr. Johnson, a 52-year-old man with nephrotic syndrome, presents with worsening edema despite being on furosemide. His serum albumin is 1.8 grams per deciliters, normal range is 3.5 to 5.0 grams per deciliters. Which of the following is the most appropriate next step in his diuretic therapy? Option A, increase the dose of furosemide. Option B, add spironolactone. Option C, switch to hydrochlorothiazide. Option D, combine furosemide with metolazone. Option E, start acetazolamide. The correct answer is option D, combine furosemide with metolazone. The explanation is that furosemide alone may be less effective in nephrotic syndrome due to hypoalbuminemia, which reduces diuretic delivery to its site of action in the kidney. Metolazone, a thiazide-like diuretic, enhances sodium excretion by acting on the distal convoluted tubule, producing a synergistic effect when combined with furosemide. Increasing furosemide alone may not significantly improve diuresis, and options like spironolactone or acetazolamide are not primary choices for managing refractory edema in nephrotic syndrome. Question 3. Mr. Green, a 70-year-old man with chronic kidney disease with an eGFR of 28 ml per minute, is prescribed a diuretic for fluid retention. All of the following diuretics are appropriate for this patient's condition except Option A, bumetanide. Option B, metolazone. Option C, hydrochlorothiazide. Option D, torsemide. Option E, ethacrynic acid. The correct answer is option C, hydrochlorothiazide. The explanation is that hydrochlorothiazide is ineffective in patients with significantly reduced kidney function, particularly when eGFR falls below 30 ml per minute, because thiazide diuretics rely on adequate renal function to exert their effect. Loop diuretics like bumetanide and torsemide remain effective at lower GFRs, and metolazone, although a thiazide-like diuretic, retains activity in patients with chronic kidney disease. Ethacrynic acid, a loop diuretic, is also an option, particularly for patients who are allergic to sulfonamide-based diuretics. Question 4. Mrs. Cooper, a 32-year-old pregnant woman with preeclampsia, is prescribed hydrochlorothiazide for blood pressure control. Which of the following statements is correct regarding hydrochlorothiazide in pregnancy? Option A, it crosses the placenta. Option B, it is absolutely contraindicated in pregnancy. Option C, it may cause electrolyte imbalance in the fetus. Option D, it decreases blood pressure by inhibiting sodium reabsorption. Option E, it acts on the proximal tubule. The correct answer is option A, it crosses the placenta. The explanation is that hydrochlorothiazide is known to cross the placenta, although its use in pregnancy is generally avoided unless the benefits outweigh the risks. While not absolutely contraindicated, thiazide diuretics can lead to fetal electrolyte imbalances, hypotension, and reduced placental perfusion, which raises concerns in pregnancy. The drug primarily acts on the distal convoluted tubule, not the proximal tubule, and its mechanism involves inhibiting sodium reabsorption, leading to diuresis. Question 5. Mr. Jackson, a 58-year-old male with gout, has been using hydrochlorothiazide for hypertension management. Which of the following is the most likely side effect of this diuretic in his case? Option A, hyperuricemia. Option B, hypoglycemia. Option C, hypercalcemia. Option D, hypomagnesemia. Option E, hyperkalemia. The correct answer is option A, hyperuricemia. The explanation is that hydrochlorothiazide reduces renal excretion of uric acid, leading to hyperuricemia, which can precipitate gout flares in susceptible individuals. This effect is particularly relevant in patients with a history of gout, making thiazide diuretics a less favorable choice for hypertension management in such cases. While thiazides can cause hypercalcemia and hypomagnesemia, the most clinically significant issue for gout patients is their impact on uric acid levels. Hypoglycemia and hyperkalemia are not common side effects of thiazide diuretics. Question 6. Mrs. Taylor, a 68-year-old female with a history of chronic heart failure, is started on torsemide. Which of the following is true about loop diuretics like torsemide? Option A, they inhibit sodium chloride reabsorption in the distal convoluted tubule. Option B, they decrease the risk of hypokalemia. Option C, they reduce preload and afterload in heart failure. Option D, they lead to hypernatremia. Option E, they are contraindicated in renal impairment. The correct answer is option C, they reduce preload and afterload in heart failure. The explanation is that loop diuretics like torsemide work by inhibiting the sodium-potassium chloride cotransporter in the thick ascending limb of the loop of Henle, leading to significant diuresis. This reduces intravascular volume, thereby decreasing preload, and also reduces systemic vascular resistance, lowering afterload. By alleviating fluid overload, loop diuretics improve symptoms in heart failure patients, making them essential in managing congestion. Question 7. Mr. Davis, a 42-year-old male with a history of chronic hypertension, is started on amiloride to minimize potassium loss. Which of the following is not a characteristic of amiloride? Option A, it acts on the collecting duct. Option B, it blocks sodium channels. Option C, it increases potassium excretion. Option D, it is a potassium-sparing diuretic. Option E, it is often combined with thiazides. The correct answer is option C, it increases potassium excretion. The explanation is that amiloride is a potassium-sparing diuretic that works by blocking epithelial sodium channels in the collecting duct. This action prevents sodium reabsorption, which in turn reduces potassium excretion, helping to maintain potassium levels in patients at risk of hypokalemia. Unlike other diuretics such as thiazides and loop diuretics, which promote potassium loss, amiloride is used to counteract this effect, particularly when combined with thiazides. Question 8. Mrs. Thompson, a 50-year-old female with polycystic ovary syndrome, PCOS, and hypertension, is started on eplerenone. Which of the following is true regarding the pharmacological profile of eplerenone? Option A, it has greater antiandrogenic activity than spironolactone. Option B, it causes less hyperkalemia than other potassium-sparing diuretics. Option C, it is a non-selective aldosterone antagonist. Option D, it is contraindicated in patients with a serum potassium greater than 5.0 millimoles per liter. Option E, it has significant drug-drug interactions with calcium channel blockers. The correct answer is option D, it is contraindicated in patients with a serum potassium greater than 5.0 millimoles per liter. The explanation is that eplerenone is a selective aldosterone receptor antagonist that can increase potassium retention, leading to hyperkalemia. Due to this effect, it is contraindicated in patients with elevated serum potassium levels, as it can further increase potassium and potentially cause life-threatening cardiac arrhythmias. Unlike spironolactone, eplerenone has weaker antiandrogenic activity, making it a preferred choice when minimizing hormonal side effects, but it still requires careful monitoring of electrolyte balance. Question 9. Mr. Carter, a 50-year-old male with hypertension and nephrolithiasis, is prescribed a thiazide diuretic for blood pressure control. What is the primary benefit of thiazide therapy in patients with calcium oxalate kidney stones? Option A, increases urinary calcium excretion. Option B, decreases renal calcium excretion. Option C, inhibits stone formation by decreasing oxalate absorption. Option D, promotes citrate excretion, preventing stone formation. Option E, reduces the formation of struvite stones. The correct answer is option B, decreases renal calcium excretion. The explanation is that thiazide diuretics reduce calcium excretion by increasing calcium reabsorption in the distal convoluted tubule. This effect lowers urinary calcium levels, which in turn reduces the risk of calcium oxalate stone formation. By minimizing calcium excretion into the urine, thiazides help prevent supersaturation of calcium, a key factor in stone formation, making them beneficial in patients with recurrent nephrolithiasis. Question 10. Mr. Robinson, a 62-year-old male with hypertension and benign prostatic hyperplasia, is prescribed indapamide for blood pressure control. Which of the following is not true regarding indapamide? Option A, it is a thiazide-like diuretic. Option B, it can lead to hypokalemia. Option C, it is contraindicated in patients with sulfa allergies. Option D, it reduces systemic vascular resistance. Option E, it inhibits the sodium-potassium 2-chloride cotransporter in the loop of Henle. The correct answer is option E, it inhibits the sodium-potassium 2-chloride cotransporter in the loop of Henle. The explanation is that indapamide is a thiazide-like diuretic that acts on the distal convoluted tubule, where it inhibits the sodium chloride symporter, not the sodium-potassium 2-chloride cotransporter, which is the target of loop diuretics. Indapamide effectively lowers blood pressure by reducing systemic vascular resistance and promoting mild diuresis. While it can cause electrolyte disturbances like hypokalemia, it remains a valuable option for treating hypertension, especially in patients with additional cardiovascular risk factors. This concludes our revision on diuretic agents. I hope this quiz session was both engaging and insightful. For deeper understanding, refer to resources like Katzung and Trevor's Clinical Pharmacology, Rang and Dale's Pharmacology, and the British National Formulary, BNF. Thanks for watching. If you found this video helpful, don't forget to give it a thumbs up and share it with others. Subscribe to this channel and hit the notification bell so you never miss an update in the series that we are doing. For more learning resources, check the description below. See you in the next video.